Okay, so good day everyone. I am Tumilig Jana Iliana, and so today we will be discussing the hyperchloremia. Okay, so firstly, let us define what is hyperchloremia. So hyper means excessive or above the normal range. Chlor means chlorine, and emia means blood condition or in the blood. So in summary, hyperchloremia literally means excessive chlorine in the blood. Hyperchloremia is an electrolyte imbalance characterized by elevated chlorine levels in the blood, typically above 106 milliequivalent per liter. So chloride is essential for maintaining fluid balance, acid balance, and also the normal cell function. So what are the causes of hyperchloremia? So first one is the excessive chloride intake through saline IV or high sodium diets. Second is the dehydration, which leads to concentrated chloride levels. And the third one is the renal disorders such as chronic kidney disease or renal tubular acidosis. The fourth one is the bicarbonate loss. This is often due to severe diarrhea or metabolic acidosis. And lastly, the medications such as the diuretics that affect electrolyte balance. So we have two types of hyperchloremia. The first one is the hyperchloremic metabolic acidosis. This is caused by the bicarbonate loss often seen in diarrhea or renal issues. And the second one is the hyperchloremic non-acidemic state, which occurs when the chloride level increases without affecting the blood pH. This is often due to dehydration.
Good day everyone. I am Narhania Tingaraan and now I'll be tackling about the pathophysiology of hyperchloremia. So let's start by understanding what chloride is and why it's important. Chloride is an extracellular electrolyte, so meaning it is predominantly found outside the cells, particularly sa plasma. So chloride is an indispensable part of maintaining the body's homeostasis. So through its regulation by the kidneys and its collaboration with sodium and bicarbonate, chloride ensures the stability of fluid, pH, and electrical processes. As we all know, the kidneys are like the body's filtration system, closely regulating the chloride levels. So if levels rise or fall outside the normal range, na yung kidneys is mag-a-adjust yung amount of chloride na na-excrete or na reabsorb doon sa urine to bring back the levels to equilibrium. So what could cause the hyperchloremia? If the patient has an excessive chloride intake, so nangyayari to commonly sa mga clinical settings. So this commonly occurs due to the overuse of saline solutions, particularly the 0.9% sodium chloride. Kasi yung normal saline is meron siyang chloride concentration na 154 mEq per liter, which is higher than what our body typically maintains. So, pag sobrahan yung pag-administer doon sa patient is pwede siyang magkaroon ng hyperchloremia. Furthermore, certain medications like the ammonium chloride or some diuretics may also contribute to elevated chloride levels by directly promoting its retention. Another one is the water loss. Conditions like dehydration can play a significant role in concentrating chloride levels in the blood. So when the body loses water due to excessive sweating, diarrhea, vomiting, or inadequate fluid intake, the overall volume of ECF decreases. However, the total amount of chloride remains the same. As a result, na yung chloride becomes more concentrated in the reduced volume of fluid, leading to elevated levels in the blood. Then magkakaroon yan ng reduced renal clearance. So the renal dysfunction, which is one of the most common causes of reduced chloride clearance, na yung kidneys are the primary organs that is responsible for filtering electrolytes like yung chloride from the blood and excreting them through urine. However, some conditions such as yung chronic kidney disease or yung acute kidney injuries na yung filtration na to and yung excretion process is impaired. So, sa chronic kidney disease is the long-term decline sa kidney function leads to an inability to efficiently remove excess chloride. So, it causes it to build up doon sa blood. Similarly sa acute kidney injury kung saan yung kidneys mo is suddenly magsa-stop mag-work properly. So yung kidneys is the kidneys temporarily lose their ability to regulate electrolyte levels, leading to chloride retention. The mineralocorticoid effects na particularly is hyperaldosteronism siya. Okay, so as we all know, the aldosterone is a hormone produced by the adrenal glands that plays a key role in regulating sodium and water balance sa katawan natin. So it does this by increasing the reabsorption of sodium in the kidneys. However, pag yung body natin is nag-retain ng sodium, yung chloride is susundan niya or the chloride follows the sodium during the reabsorption sa kidneys. So, nangyayari to because yung sodium and yung chloride are both charged particles. So, the sodium is positively charged while yung chloride naman is negatively charged. And the body needs to maintain a balance of electrical charges called electroneutrality. So, if the sodium is reabsorbed into the blood, chloride moves with it to keep the overall charge balance. Then, magkakaroon siya ng chloride shift between the compartments. So, in this condition, the body is dealing with too much acid sa blood. So, normally, a compound called bicarbonate helps balance the acidity by acting as a buffer. Kumbaga, yung bicarbonate is siya yung nagbi-maintain ng pH balance sa katawan natin. However, the metabolic acidosis happens when there is too much acid in the blood. So, the acid comes from hydrogen ions, which are the main contributors to acidity. So, para ma-neutralize yung acidity na yun, the body uses a chemical which is yung bicarbonate. So, yung bicarbonate acts like a sponge that soaks up the excess hydrogen ions. So, as the bicarbonate neutralizes the hydrogen ions, it gets used up in the process, meaning there is less bicarbonate na natira doon sa blood. So, this loss of bicarbonate is one of the reasons why the body's acid-base balance is thrown off during the metabolic acidosis. So, para ma-maintain yung electrical neutrality or yung balance ng positive and negative charge sa blood, na yung the body allows the chloride levels na tumaas as the bicarbonate drops. Kumbaga, yung chloride acts as a replacement for the lost bicarbonate because it has a negative charge. It helps keep the electrical balance in the blood stable. Kumbaga, in short, na pag mababa yung bicarbonate is nagiging replacement yung chloride para ma-balance yung electrical neutrality doon sa blood. Then, sa compensatory mechanisms, na yung respiratory alkalosis occurs when there is too little carbon dioxide sa blood, making it less acidic. So, para ma-balance to, na yung nagsistep in yung kidneys para ma-restore yung pH level sa katawan natin. So, normally, yung bicarbonate is filtered out para ma-help na ma-maintain yung acid-base balance. However, as bicarbonate is reduced, the kidneys start retaining chloride ions. So, tumutuloy yung chloride para ma-replace yung nawala na negative charge from bicarbonate, ensuring the blood maintains electrical neutrality. So, this compensatory mechanism helps the body cope with the changes caused by the respiratory alkalosis and prevent further imbalance. In simple terms na, as the body loses bicarbonate, it adjusts by increasing chloride to keep things balanced. So, ito yung tinatawag natin na chloride shift. Moving on, in certain conditions, the balance between acids and bases in the body is disrupted, leading to acid-base imbalances. In hyperchloremic metabolic acidosis, pag yung chloride level sa blood is nag-increase excessively, then it reduces the strong ion difference. Kumbaga, yung strong ion difference is yung balance between the positively charged and negatively charged ions sa blood natin. So yung shift na to, this shift lowers the blood pH, making it more acidic. So this type of acidosis often occurs when there is an overuse of chloride-rich intravenous solutions or when yung bicarbonate levels drop significantly. In the case of loss of bicarbonate, as I've said earlier, the bicarbonate is an essential buffer that helps neutralize the acids in the body. So pag nawala yung bicarbonate commonly through severe diarrhea or other gastrointestinal issues na yung katawan natin, yung katawan ng tao cannot neutralize the acids effectively. As a result na yung serum chloride is tumataas siya para ma-maintain yung electrical neutrality sa blood natin. When chloride levels in the body are too high or the blood becomes too acidic, several cellular functions can be affected. One of them is the disruption of enzyme function and cellular processes. So the body relies on a stable pH level for enzymes to work properly. The enzymes are proteins that help carry out the essential processes like the digestion, energy production, and the cell repair. So pag yung pH balance nag-shift siya due to high chloride levels, the enzyme activity can slow down or stop, causing issues sa normal cellular functions, as well as for the impaired heart function and blood vessel tone na yung hyperchloremia can weaken the heart's ability to contract effectively, which may reduce how well the heart pumps blood. It can also disrupt the balance in blood vessels, leading to changes in vascular tone. So these effects may result in unstable blood flow and blood pressure or yung hemodynamic instability. So it can be a risk to vital organs. Then what are the possible systemic effects for a patient with hyperchloremia? So merong mga neurological effects na pwedeng maramdaman ng patient. It is when the chloride levels disrupt the body's acid-base balance and it can affect the brain function. So, pwede siyang magresulta sa mga symptoms tulad ng altered consciousness, lethargy, and confusion. These issues occur because yung brain is sensitive siya sa mga changes sa pH and electrolyte levels, which can interfere sa normal neural activity. So, meron ring mga cardiovascular effects kung saan yung high chloride levels, especially pag combine siya sa imbalance sa potassium na pwedeng mag-increase yung risk of arrhythmias ng patient. So, the heart relies on stable electrolyte levels to maintain a steady rhythm. So, pag na-disrupt yun, no, pwede yung mag-lead sa dangerous na mga irregularities that may affect the blood circulation. And for the renal effects, the hyperchloremia can reduce the blood flow to the kidneys o yung tinatawag na renal perfusion, making it harder para sa mga kidneys na ma-filter and ma-regulate yung waste and electrolytes. So this additional strain doon sa kidneys kung saan pwedeng mag-worsen yung existing na kidney dysfunction or pwedeng mag-contribute pa sa new problems doon sa patient. Then these are the signs and symptoms of patient with hyperchloremia. Okay, the first one is the fatigue and weakness. So, pag sumobra yung chloride na pwede niyang maapektuhan yung cellular functions ng tao. So, it leads to reduced energy levels and generalized weakness doon sa patient. So, meron ring dehydration symptoms. So, pwede magkaroon ng signs such as yung dry mouth, thirst, and reduced urine output ng patient. So, especially if yung hyperchloremia is caused siya by fluid loss. And meron ring confusion and lethargy. So, as I've said earlier, is yung brain is sensitive siya sa changes ng pH and electrolyte levels. So, the high chloride can disrupt the brain function, leading to mental fog, confusion, or drowsiness. So, yung rapid breathing or hyperventilation is yung katawan ng tao may try to compensate for acid-base imbalances by increasing breathing rate to expel para ma-expel yung mga excess na carbon dioxide, so which can make the blood less acidic. Then the high blood pressure or yung hypertension is pag yung increased na chloride levels can cause water retention leading to elevated blood pressure. Then yung edema or yung swelling naman is yung retention ng sodium and chloride can lead to fluid accumulation causing swelling doon sa different parts of the body. Then yung irregular heartbeat or yung arrhythmias is pag yung electrolyte imbalances, especially pag combine siya with other issues like low potassium na pwedeng makadisturb sa heart rhythm ng tao. Then the muscle twitching or cramps na the changes in electrolyte levels can interfere doon sa normal muscle function ng patient resulting sa spasms or cramping. Then the reduced kidney function is pag yung hyperchloremia na ma-worsen niya yung kidney perfusion ng patient na it can potentially cause decreased urine output or additional kidney-related symptoms. Then there are also some metabolic acidosis symptoms if yung hyperchloremia leads to acidosis na additional symptoms may include nausea, vomiting, increased depth of breathing as the body attempts to restore yung balance ng katawan ng patient. These are the key diagnostic tests to a patient with hyperchloremia. The serum chloride test na mini-measure na yung level of chloride ng patient. So pag yung chloride level ng patient is above the normal range, na pwede siya mag-indicate ng hyperchloremia. Yung arterial blood gas naman is an analysis that evaluates the acid-base balance sa blood ng patient. So, dinidetect niya if metabolic or respiratory acidosis or alkalosis yung patient, which often accompanies na may hyperchloremia yung patient. Yung comprehensive metabolic panel naman is it assesses other electrolytes such as yung sodium, potassium, and yung bicarbonate, and yung kidney function markers like yung blood urea, nitrogen, and creatinine. So it helps para ma-identify yung related imbalances or kidney issues na nag-contribute sa hyperchloremia. Yung urine chloride test naman is mini-measure na yung chloride levels doon sa urine para ma-determine whether yung kidneys are properly excreting chloride. So it differentiates between the renal and non-renal causes of hyperchloremia. Yung serum sodium levels naman is since chloride is closely associated sa sodium, na this test helps evaluate sodium-related disturbances. So, pwede rin magkaroon ng imaging studies if kailangan. So, yung ultrasound or yung CT scans may be used para ma-assess yung kidney structure and function in severe cases. And these are the medical management for a patient with hyperchloremia. And the first one is treating the underlying cause. If the underlying cause is dehydration, then kailangan ng rehydration with appropriate fluids such as oral or intravenous fluids. So, pwedeng mabalance mo yung solutions doon sa 0.9% na normal saline or yung sodium chloride ng lactate ringer solution para ma-restore yung chloride balance without exacerbating acidosis. So, if it is because of excessive saline administration na if caused by overuse of normal saline na the infusion, pwedeng i-reduce mo or stop mo yung infusion ng normal saline. So, and a more balanced electrolyte solution is substituted. And the other one is correcting acid-base imbalances. In metabolic acidosis, the blood becomes too acidic due to excess hydrogen ions. So yung sodium bicarbonate may be administered orally or intravenously para ma-neutralize yung acid. So it works by increasing the blood's bicarbonate levels, which helps para ma-restore yung healthy pH balance ng katawan ng patient. And a careful monitoring of blood pH, bicarbonate levels, and the anion gap, which is yung difference between the measured cations and anions, is critical na medical management para sa patient. Then the overcorrection can lead to alkalosis, where the blood becomes too basic, creating new complications. So, yung pag-address sa bicarbonate loss, so if yung bicarbonate is lost due to diarrhea or kidney dysfunction, then the measures are taken para ma-replace yung nawala na bicarbonate through oral or IV supplementation. In managing electrolyte imbalance, for the potassium imbalance the potassium levels are monitored because chloride imbalances often occur alongside potassium disturbances. So pag mababa yung potassium it is replenished carefully. As for the sodium levels naman, because the high chloride often accompanies high sodium, pag mataas yung chloride is pwedeng mataas rin yung sodium, na restricting dietary sodium or adjusting saline intake helps para ma-restore yung balance. Another one is enhancing renal clearance. If the kidneys are functioning but not excreting enough chloride, na yung loop or thiazide diuretics can increase urine output and facilitate chloride excretion. And para naman sa mga patients na may severe kidney dysfunction or failure, so yung dialysis may be needed para ma-remove yung excess chloride and ma-maintain yung electrolyte balance ng patient. And then another one is the dietary modifications. Reducing chloride intake from food such as yung mga table salt and processed foods may be recommended doon sa patient. And encouraging a balanced diet with fresh fruits and vegetables that support kidney function and electrolyte balance is recommended para doon sa mga patient na may hyperchloremia. Then for monitoring and supportive care, the regular monitoring of electrolyte levels, blood pH, and kidney function is vital para ma-ensure na effective yung treatment doon sa patient. And the oxygen therapy or mechanical ventilation may be used in severe acidosis para ma-improve yung oxygenation and ma-reduce yung carbon dioxide levels ng patients na may hyperchloremia. And lastly is the preventive measures. Then adjusting the IV fluid compositions in hospitalized patient para ma-avoid na magkaroon ng excessive saline administration and proper management of chronic conditions like kidney disease, heart failure, or gastrointestinal disorders para ma-prevent na magkaroon rin ng recurrence doon sa condition.
So let's move on to the nursing diagnosis and its management. So the first one we have is the electrolyte imbalance related to excessive chloride intake or impaired renal function. So its interventions are monitor lab values by regularly assess serum chloride, sodium, potassium, and bicarbonate levels. Following by regulating the IV fluids, administer hypotonic solutions or balanced fluid as prescribed to dilute the chloride levels. So the second one is the risk for impaired gas exchange related to changes in acid-base balance caused by metabolic acidosis from hyperchloremia. So its intervention firstly is observe for increased respiratory rate, depth, or signs of cosmal breathing, followed by identifying and managing acid-base imbalances. If hypoxemia is observed, administer oxygen as prescribed. And if metabolic acidosis is confirmed and bicarbonate replacement is indicated. So the third one is the deficient fluid volume related to dehydration contributing to concentrated chloride levels. So firstly, record and evaluate for signs of dehydration, provide prescribed fluids to correct the dehydration and dilute serum chloride, and if the patient is able, encourage patient for adequate water intake. Now, the fourth nursing diagnosis is the risk for activity intolerance related to fatigue or muscle weakness caused by electrolyte imbalances. So, firstly, for the intervention, evaluate the patient's ability to perform activity of daily living, alternative activity with rest, conserve energy, and lastly, observe for improvement or worsening of muscle weakness as chloride levels normalize. So the last one is the knowledge deficit related to lack of understanding about dietary or medication management of electrolytes. So first, teach the patient to reduce intake of high calories food, like for example, some processed foods or salty snacks. So the second one is discuss the effect of diuretics, bicarbonate supplement, or other prescribed medication on the chloride levels. And lastly, the surgical management. So we have here three surgical management. The first one is the gastrointestinal fistula repair. This closes the abnormal connection between the intestine and the skin or other organs to reduce the chlorine loss. The second one is the nephrectomy or the kidney removal. So this removes the diseased kidney contributing to electrolyte imbalances. And lastly, the adrenalectomy or the removal of the adrenal gland. So this treats the primary aldosteronism or the Cushing syndrome condition causing excessive cortisol and aldosterone production. So that's all for the hyperchloremia. Thank you for listening.